I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
What we're going to talk about today is eating a better diet, eating a plant-based diet. Now, we call the show Debunking the Myths of a Vegan Diet because I've been doing nutrition consultations now for 35 plus years. And whenever I sit down with a patient, I always try to match them. I want to find out what you're okay with. Some people are like, Dr. Joe, I'll do whatever you say. I want to get well. And that's most of the patients. That's probably 85, 90% of the patients. Every now and then somebody will say, I don't know, Dr. Joe. I don't know if I can do everything. And I heard, I love that one. I looked on the internet and found out that, well, vegan diet might be lacking B12, vitamin B12. That's true. Absolutely true. We're going to talk about that and why that's not that big a deal and why some of the things they've heard are never a big deal. Because I've been plant-based now for 34, 35 years. Never missed a meal. I'm fine. I have to watch my weight. I put on weight pretty easily. So you're not going to starve to death. And the nutrient level that you're going to get in your body is just off the charts. So I don't think there's any question anymore. It's pretty much universally acknowledged that a plant-based diet can do wonders for your health. It's good for the environment. It's good for your wallet. It's way cheaper than anything you're doing right now, like ridiculously cheaper how much money you're going to save. And so plant-based diets, what that means is you cut out the animal products, the meat, the fish, the poultry, the eggs, the dairy, and make your diet consist mainly of fruits and vegetables, nuts and seeds. That's when you up your ante on what you're eating. The results show that 1.8 million deaths could be avoided annually across the globe if people switch to a vegan diet. Now, eventually these people are going to die. Even vegans die. Yes, even I may die someday. I don't know. But it's going to cut back so much on the cost of health care. It's going to increase your immune system, reduce your risk of getting sick. There's no downside to eating a good diet except one. And the only downside that I can think of is those bad foods, they taste good. Because I remember, I was normal at one time. And I used to eat things like alcohol, meat, sugar, dairy, coffee, soda, artificial sweetener, breads, cookies, cakes, donuts, pastas. And so I know what that's like. And I admit it. I miss meatball sandwiches. I miss double beef cheese hamburgers. But we're going to talk about some of the things that you might not understand. And here's the thing with going to a plant-based diet. You have to do nothing. In fact, you have to not do things. So I couldn't make it any easier. I'm making it passive for you. You just have to not do things. Leave the bad foods out. And if you're not ready to go, you know what, Dr. Joe, I'm not going to do this all the way. Great. Let's go in steps. Let's go slow. I'm going to hold your hand, go step by step, how to make little changes in your diet. You'll be amazed. I've consulted, I'm going to guess, tens of thousands of people with radio, television, books I've written, maybe more than that. I don't even know. And it's amazing because people come to me all the time and say, Dr. Joe, why didn't I do this sooner? It'll blow your mind. So eating more plant-based diet is much more mainstream than it used to be. When I first did this 30 some odd years ago, it was a little more fringe. Now everybody's doing it. I mean, Beyonce, Jay-Z, Bill Clinton. Let me tell you a Bill Clinton story. Years ago, when Bill Clinton was in office, two men came to me. This sounds like a movie, right? And they said, we want you to put together a dietary protocol for Mr. Clinton. I don't know if it was real or not. So I wrote down what to eat, breakfast, lunches, dinner, snacks. Of course, everything was plant-based. And since that was right around his heart attack area, and he went to a plant-based diet. Now, I don't know if these guys were real. I don't know if the information ever got to... Did I ever tell you this story, Garrett? I don't think I even told you this story.
No, I don't.
This is a new story for you guys.
I feel like I heard you say it one time on
Maybe,
the radio.
Yeah. But I have the paperwork still. I still have what I gave them. I don't know who they were. And I gave it to them, and Bill Clinton went plant-based after that. So maybe.
So basically, you're a trendsetter.
I'm a trendsetter. I was cool before it was cool. So it's possible that I'm the one who was part of the protocol to help Bill Clinton go plant-based. But things like that, regardless of your political beliefs, it makes it more mainstream. And I don't know why it's not mainstream. It's just eating. Eating doesn't have to be trendy. Eating should be what's the best for you. So anyway, like I said, it's a lot easier than it used to be. So question for you, should you start doing this? Well, let's find out. One benefit, plant-based or vegan diet promotes weight loss. So right away, people go, I like this. This is a good story. I can lose weight. So the immediate results of adapting a plant-based diet, one of the positive things and attracts vegans is that it helps you lose weight. Now, I was talking to a vegan friend of mine, was it yesterday? And she said, well, there's dangers to a plant-based diet, going to a vegan diet. And I said, well, that's what I'm going to be talking about. I thought she was joking with me. She goes, what'll happen is you'll lose weight and get so healthy that your spouse is going to be jealous. And if they catch you talking to somebody else, they'll kill you. So eating a vegan diet can be life-threatening, according to one of my consiglieres there. So... But it's true. When you go to a plant-based diet, you feel so much better. You look so much better. And like I said, it could be dangerous if there's a spouse involved that may be jealous, or just get them to go plant-based. And then you both go backwards in aging and you get to spend more time together. See, there's one romantic benefit of it. Vegan diet, much lower in calories, even a vegetarian. Now, vegan is nothing but nothing but plants. I'm sorry, no meat, butter, cheese, yogurt, eggs, ice cream. Vegetarian, in one of my books, Eating Right for the Health of It, I've seen if I had a copy of it here, I don't. Eating Right for the Health of It, we talk about the different types of vegetarian. There's lacto-ovo, which means you eat eggs and milk, and there's a pesco vegetarian, which means you eat fish, which I don't know how that's a vegetarian because it's still an animal. But even vegetarian diet, you're going to be eating a lot less calories in most cases. So because of knocking out the meat, you're knocking out those high fat dairy products and meat products that cause you to gain weight. And you'll feel great. Now you start to lose weight. Okay, so far I don't see any downside to this. We attribute the weight loss to a vegan diet to much lower fat content in the vegetables. Now, if you've ever studied fat, carbohydrates, and proteins, it's about 3 times more calories, maybe 4 times more calories in a gram of fat than there is of protein or carbohydrates. So you're eating a lot more. Now, there are some diets that say you should go to mostly fat. You cut out all the carbohydrates, go mostly to fat. I don't like that. You might lose weight because you're going to shift from burning sugar from the carbohydrates into burning fat to burn ketones. Studies are now coming out, your body's not doing well with a ketogenic diet. After about 2 months, you really want to switch back to a normal, good plant-based diet because we're starting to see it has an effect on the heart. Now, if you have seizures, we found that doing this is very, very good for you. But if you have seizures, you also want to consider what's causing the seizures. You can affect them chemically, but what I find from a chiropractic standpoint is the top bone in the neck twists out of place. Every seizure patient I've ever seen, I've seen a lot in my career, 37 years of doing this, the bones move out of place, they pinch the nerves, and that puts a pressure on what's called the brainstem. Now, the brainstem is the part of the brain that controls motion. So if we can put that atlas back in place, not all, but in most cases, atlas is your top bone, most cases we get some amazing results with seizures. So again, I'm not a big fan of the ketogenic diet. If you want to do it, again, whatever you do is up to you. It's always your choice. I'm just here to give you information. Whatever you do with that information is what you're going to do with it. But when you cut back on a lot of those meats and dairy products, chances are you're going to start to lose weight. Now, here's the thing. There's a downside to this. Benefits to losing weight, but if you lose all this weight all of a sudden, it could backfire. Some vegan diets are restrictive, and people think it's restrictive. It's really not. There's so many more choices to eat on a plant-based diet. So here's something I want you to consider. If you could write down everything you ate for the past year, let's fantasize here for a second, you would see a pattern. Most people eat the same things over and over again. And what I've found in my research is about 6 foods that people eat over and over again. So if you're a meat eater, you're potentially having chicken one night and steak one night and shrimp one night, whatever it is, eggs, you'll see the same pattern over and over again, meat, butter, cheese. And if you could take those out and replace them with 6 other foods, your variety is the same. But what you're going to find is when you start eating more plants, the variety skyrockets. I mean, meat is meat. It's meat, it's chicken, there's beef, there's pork. That's about it, really. But when you start looking at plants, oh my gosh, there's tons of different kinds. And if you don't know what to eat, I have a book I wrote called Eating Right for the Health of It. And in the book, the first half of the book tells you how to change your diet. And the second half of the book is well over 200 recipes. And everything in there is plant-based. There's no soy in it. Some people have problems with soy. We'll talk about soy in a second if we have a chance. It's not bad. No wheat, because a lot of people have wheat reactions, and I really want you to consider cutting out your wheat. And the 2 foods you want to cut out right away would be dairy products and wheat. Now, wheat I know is a plant, but when you eat wheat, most people have a reaction and oftentimes get bloated. And when you get bloated, you feel fat. And so when you cut out the wheat and the dairy, it calms down the immune system. And so there's another benefit, helps your immune system. And we did a show on immunity. We talked about that. If you go to our website, drjoe.com, we have well over 1,000 hours of podcasts. If you go to media, we have audio, we have video, depends how you like to learn. And so you can pick what you want, watch it, listen to it. And we talk about the immune system. Two of the things you got to cut out right away are wheat and dairy. So again, you're probably going to lose weight going to a plant-based diet, much higher fiber. So you go to the bathroom more often. So it's really a lot of benefits to that.
When
so,
you were talking about the how many different ways you can prepare vegetables or how many different vegetables you have at your disposal. Think about tacos. We'll make tacos at least one night a week. We'll use cauliflower. We can use sweet potato. We can use jackfruit.
Black beans, any type of bean or legume. There's endless possibilities, and it makes it more exciting because you have to wait for seasonal vegetables. So you get to wait all year, and you're like, oh, it's finally blueberry season.
Yes, blueberry tacos.
And aside from like some slow roasted pork or something like that, vegetables hold so much more flavor.
Yeah. I agree. And that's the one thing nice about it. You know, beef is beef. What do you got to do? You got to season it. Well, you could season lentils if you wanted to. You know, if you listen to the show all the time, you know I love Ethiopian food. And there's so many different ways you can season the vegetables there. And they do have meat in the Ethiopian diet, but there's not a lot of meat in Ethiopia. So they're usually eating the vegetables. And there's, like you said, there's so many different ways to season it. You want to make it taste Italian or Mexican or Ethiopian or German. You can decide what kind of seasoning you want. And so tacos don't, like you said, don't have to be Mexican. So that's a really good point. There's so many different ways you can do it. You just do a guacamole taco if you wanted to, I guess. There you go. So if you start losing the weight, that's an okay thing. But what may happen is you're not going to feel as full when you first start doing this. Because when you eat, like Garrett said, pork and beef and chicken, you're going to feel very full.
It's so rich.
It's very rich. I couldn't imagine eating a piece of meat now. I mean, like even thinking about it, what would it be like?
Does it make your jaw get tight?
I can't imagine chewing meat. Yeah. I haven't chewed a piece of meat in 30 some odd years now. So what's going to happen is you may start feeling hungry. So I don't want you to fall into this trap where you say, what's going to make me feel full? Well, there's some foods that are what we call accidentally vegan. They don't mean to be vegan, but they are, like chips, for example. And there's all sorts of seasoned chips, and there's all sorts of cookies, chocolate cookies with cream filling many times are vegan. And so I don't want you to start filling up on the junk food because that'll make you feel full. Why? It's loaded with fat. So what I teach when I teach people how to switch their diet is I want them to go to some fatty foods, add some nuts, add some avocados, add some olives. And what you're going to find is that alone is going to make you feel full. I'm a huge fan of hummus. I love hummus. Add some olive oil to it. And you're going to feel full, but you're not going to feel bloated like you do when you're eating the animal products. So again, one of the upsides is losing weight. One of the downsides is you might not feel full. Easy to fix. Throw a couple of handfuls of nuts in there and you're fine. And another pro about being a plant-based or vegan diet, it reduces your risk of serious diseases. And this is the key. You know, we go through crises. We may go through pandemics. And the thing that gets me when these things happen is everybody says, you know, what kind of drug can we come up with? What kind of vaccine can we come up with? How can we treat the symptoms? And I'm okay. I'm not going to argue that point. If that's fine. But I didn't see anybody, well, I think me and Dr. Oz were the only two that actually talked about it, was what can you do to build up your immune system? What can you do to make yourself less susceptible? So it's not just a viral infection we have to worry about. What about heart disease, diabetes, cancer, high blood pressure, obesity? There are so many things you can do to be proactive. In fact, it was a couple of weeks ago we did a show on being proactive. It's on the website, drjoe.com, and we store all our shows there, by the way. So there's one study, 2015, published in the Proceedings of National Academy of Science. Vegan diets are even more effective than vegetarian diets in protecting against hypertension, type 2 diabetes, and cardiovascular disease. If you have these diseases, if you don't want to get these diseases, why not be proactive? Every day. I mean, I hate to even teach this because patients come in our offices every single day and they say, Dr. Joe, I have diabetes, I have heart disease, I have cancer. I want you to work on me. What have you done so far? Well, I went the medical route, which is perfectly fine. I went the medical route. I took the drugs. I had the operations if sometimes necessary, but I'm still having the problems. What can I do? And I love when they say this, get to the cause of the problem, not just treat the symptoms. That's when my tail starts wagging and I get all excited and I say, okay, you want to get to the cause? You're in the right place, because that's what we do in our offices. And we co-manage so many cases. People say, I'm going to stop taking my drugs and come see you. No, don't stop taking your medication until you're healthy enough to come off the medications. I'm not against drugs. I'm against unnecessary use of drugs. Plant-based diets are lower in saturated fats. Vegans are less prone to obesity. They have a lower blood pressure, lower cholesterol, and a diet can even reduce certain types of cancer. I donate blood a lot. Every chance I can, I donate blood. And when I sit down and they put the needle in my arm, I have to tell them, my blood's going to come out faster than what you expect. And they always go, nah, 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 nah. And then they look at the bag of my blood and go, oh my gosh, your blood comes out so much faster because it's not gunked up. When you eat a saturated fat diet, the red blood cells will clump together. Number one, they're not going to carry oxygen, so you'll get tired. And number two, the blood doesn't flow as smoothly. So part of staying young, part of staying flexible, part of having good brain function, kidney function, sex function is having good blood flow. And so if you're having good blood circulation, the chances of you getting sick drop dramatically. So there's no downside to doing this except the one. If you're just joining us, the one downside is a lot of those bad foods sure do taste good. Not going to lie to you. But my decision so many years ago was it worth it? And the answer to me was no, it wasn't worth it. You know, I'd love to have a meatball sandwich with provolone cheese on a nice Italian bread made from New York, because the New York is at a different barometric pressure and the bread rises differently. My grandmother taught me that. And that's why you get good crunchy bread in places like New York, San Francisco, Rome, Paris. They're at sea level. I digress. Let me go back to what I'm talking about here. Assuming you're consuming a lot of fruits and vegetables, you're going to get something called phytonutrients. Phytonutrients are nutrients that come from plants. And they help with everything from blood flow to healing wounds to heart disease to brain function. And it's also something called antioxidants in a plant-based diet. Now, antioxidants fight free radicals. Free radicals are like Pac-Man. They they eat through things. Like an acid. Let's assume we pour acid on our skin. It's going to eat through our skin. Well, what happens is with antioxidants, they neutralize those free radicals and slow down the damage that the free radicals are causing. And part of that damage is aging. Most people guess I'm about 15 years younger than I am. And I'm okay with that. I'm perfectly fine with that. 15, sometimes 20. And I'm good with that. And I'd never tell them my true age. Girl never tells. So a diet excluding all animal products does have some drawbacks. And I started the show by saying B12. Also omega-3 fatty acids. These are things that are present in meats and dairy products. A key nutrient that the vegan diet is lacking are omega-3 fatty acids and B12. And that's about it. So people say, well, you get your B12 from eating animals. Well, what happens is bacteria will eat the flesh of the animal as it decays, and the bacteria spit out B12. And then you eat it, and you get B12. Folks, you need a thimbleful of B12 in a lifetime. That's how much you utilize. Very, very little amount. And here's the key with B12. Many times if you're getting it, whether an animal diet or a plant-based diet, you may not be absorbing it. In your stomach, you produce something called intrinsic factor. Now, intrinsic factor is a chemical that's produced in your stomach and it absorbs B12 into the body. As we get older, our intrinsic factor drops dramatically. So one of the things that a lot of doctors will do is give senior citizens a B12 shot because it bypasses the stomach, goes right into the blood. It's pretty good, give you a good rush of energy. But if you fix the stomach, fixing the cause, chances are you'll absorb your B12. Even as you get older, you'll still have good absorption. So what can affect intrinsic factor? Age. But many times the stomach can push up against the diaphragm. And if the stomach is pushing up against the diaphragm, it's not digesting food properly. The kind of spasms, it can actually rupture up or herniate through the diaphragm. There's a little hole in the diaphragm called the lower esophageal sphincter. And when you eat food, the sphincter opens, food drops in, it closes, you digest food and you pass it on. Many of you, the stomach is pushed up through that hole. When the stomach is pushed up through that hole in the diaphragm, you might have burping, acid reflux, bad breath, irritated vocal cords, sinus problems. The acid is coming up into your throat. Ultimately, if it goes on long enough and is bad enough, it can eat away. It's called eosinophilic esophagitis, and that could lead to things like esophageal cancer. And so many times with our patients, we need to pull the stomach down away from the diaphragm. And then I find that the patient is absorbing B12 better. So I'm assuming, and I have no documentation on this because nobody's going to pay for these studies, that if the stomach is working properly, it absorbs B12 better. But we do tests in our office. It's called a Micronutrient Test. We can take a little blood sample and measure multiple different nutrients in the body to see where you are. And one of the things we also measure is omega-3 fatty acids. Omega-3 fatty acids come from animal products. You need omega-3 fatty acids to make your brain function, to help with the immune system, to help with inflammation. And the omega-3 fatty acids, you would think, what's the source that most people think of? Fish. Well, fish have omega-3 fatty acids in them. Yes. The fattier the fish, mackerel, tuna, the fattier the fish, the higher levels of omega-3 fatty acids. It's great. So eat more fish. It's a catch. Fish don't produce omega-3 fatty acids. Fish get them from eating smaller fish, who eat smaller fish, who eat algae. Algae, chlorella and spirulina, produce the omega-3 fatty acids, and then the fish, it kind of works its way up the food chain. So if you take in the chlorella and the spirulina, the algae, you're getting the purest form of omega-3s, taking the fish out of the whole sequence there. And the problem with fish is the bigger they get, the more mercury they collect in their fat. And so unless you're getting an omega-3 fatty acid that's been filtered, cold filtered, and they process out the mercury, chances are you're going to get mercury in it. That's why I never recommend taking cheap supplements, especially omega-3 fatty acids. Chances are they're high in mercury. So why not just take the omega-3 fatty acids? Save the fish, save the oceans, don't kill the fish, and you're getting a pure form of omega-3 fatty acids. That's the kind of omega-3 that I take. It's on the website, drjoe.com. It's Dr. Joe's omega-3 fatty acid. Take it every day. Helps my brain function, helps with inflammation, helps keep me young. There's no downside to taking the omega-3 fatty acids if they're in algae form, because there's no mercury in that form either. The B12, all right, could be an issue. It takes a long time to get B12 deficiency, by the way. So I just take Dr. Joe's B complex. Also, we put B12 in Dr. Joe's Essential Source. Now, if you're new to the show, Essential Source is our flagship product. It's a powder. It has over 73 different ingredients in it. It's prebiotics, probiotics, digestive enzymes, a complete multivitamin. Tastes great too. So I take that every single day. I take Super Greens, which is another product, and Essential Source. Super Greens has chlorella and spirulina in it. There's your omega-3. So Super Greens and Essential Source, I take an additional omega-3 fatty acid, and then I take the B complex. That's part of my supplement protocol. I couldn't imagine a day going by without taking that. It's incredible. And once you start doing this, this is what's going to happen. Patients come to me every day. I get emails every day from all over the world. We ship our supplements all over the world. And people say, why didn't I do this sooner? Why didn't I go to a plant-based diet? I feel better. It's cheaper. I'm losing weight. My fat stomach is going away. My bloating is going away. It's amazing. And then what happens is this. People cheat. Then you cheat. You go out and you have yourself, some cheesecake and like Garrett said, a pork sandwich or whatever you're into. And you'll feel awful. And you'll say, why did I cheat? Garrett, you have a little chicken wing story you want to tell real quick? Shame on you.
I got hit with some serious karma. I was probably vegan for about 6 months and went to my first Braves game in a long time. It was one of those fancy seats where it comes with the big buffet and all-you-can-eat food. I had 3 chicken wings. 3.
Not a lot. Right.
I paid for it for at least a week.
Yep.
If not 2. I spent the last 2 or 3 innings of the game in the bathroom. It was just not worth it. Not worth
a 3 chicken wing ball game, right? Even if it was free, right? And that's the thing, and I got to warn you about this. We're talking about the dangers of a vegan diet. One of the dangers is once you start doing this, it's hard to go back. So just prepare yourself. Once you start feeling good and you start getting all this energy and it becomes cheaper and your digestive system changes, and Garrett only did it for a few months and had his chicken wing story. So just prepare yourself. Once you do this, you can go back, but it's really not worth it. So back to B12. Plenty of sources of B12 out there. Fortified foods will have B12 in it. Nutritional yeast is oftentimes fortified with B12. I just take Super Greens and Essential Source and Dr. Joe's B12. This way I know I'm getting the purest form that you can get. Almost break time. It's amazing. I got so much to cover. It's getting a lot easier to be plant-based. When I went plant-based years ago, it was beans and rice and salad. That was about it. I have yet to go anywhere. I've traveled all over the world. I've been on cruises, airlines. I've never, ever missed a meal. There's always something to eat. So if you have any health problems, neck pain, back pain, shoulder pain, headaches, numbness, tingling, muscle weakness, acid reflux, heartburn, digestive issues, nutritional concerns, come see us. Don't be like so many of our patients that say, why didn't I do this sooner? Why did I wait so long? You can make an appointment right online. Our website, drjoe.com, drjoe.com. Over 1,000 hours of podcasts right there on the website. Follow us on Facebook and Instagram at Dr. Joe Esposito. We live broadcast a lot of our shows. We post almost every day. Folks, I'm Dr. Joe Esposito. Tell your friends about the show. Thanks for being here. Catch you next time. Thanks for listening to For the Health of It.
Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on a WSB Radio app.